Hello everyone. Today we'll be talking about platypnea. Platypnea it is also called as platypnea orthodeoxia. It means that there is breathlessness in sitting posture, as this breathlessness get relieved on lying down in supine position. So whenever a patient changes position from a recumbent position or supine position to a sitting or standing posture, patient get breathlessness. So there are various causes of this. One could be intracardiac shunt. Second is extracardiac causes. So intracardiac shunts, the causes are patent foramen ovale, atrial septal defect, and atrial septal aneurysm. Extracardiac causes is pulmonary arteriovenous malformations, lung parenchymal disease, and hepatopulmonary syndrome. We'll go through this one by one. So why this platypnea occurs in sitting posture? This. So in case of patent foramen ovale or atrial septal defect, so, for platypnea to occur, so normally what happens in this patent foramen ovale or atrial septal defect, normally the left atrial pressure is more than the right atrial pressure. So what will happen is the blood will normally go from left atrium to the right ventricle, right atrium, left atrium to the right atrium. So there is oxygenated blood in left atrium, deoxygenated blood in the right atrium. So normally when there is left to right shunt, there will be no admixture of this blood, and thus there is no cyanosis or hypoxia or no breathlessness. So now, due to some reason, whenever there is increase in right atrial pressure. Suppose this right atrial pressure increases more than that of left atrium, as it may occur in case of pulmonary hypertension. Severe pulmonary hypertension patient develops. So there could be increased right ventricular pressure, which will be transferred to the right atrium. So there will be more right atrial pressure, which will lead to what will happen is there is right to left shunt. So whenever there is right to left shunt, this in right atrium there is deoxygenated blood. This deoxygenated blood gets mixed with the oxygenated blood in the left atrium, and this leads to hypoxia or called as or lead to hypoxia or cyanosis here. So why this occurs only in the sitting posture? Why not this may lead to the symptoms in supine position? If we see that, so what has been given an explanation is that in case of sitting position, there is found to be more stretch of this interatrial communication. In sitting posture, what happens is there is more stretch of this interatrial communication. The more will be the shunt, and thus more will be the deoxygenation, and more will be the hypoxia and breathlessness. So in sitting posture, that's why a patient gets breathlessness in sitting posture in these patients of patent foramen ovale and a patient of atrial septal defect. In patients with intrapulmonary shunts like hepatopulmonary syndrome or patient is having underlying lung disease. So suppose a patient is having hepatopulmonary syndrome. So in hepatopulmonary syndrome, what happens is there is communication of the liver vasculature with the lungs. So normally the base of the lungs are closer to the liver. So thus base of the lungs are more commonly involved in this in hepatopulmonary syndrome. So that is there is communication between these two vasculature. So in sitting position, what happens is because of the sitting posture, because of the gravity, more blood goes in the bases of the lungs when compared to the upper part of the lungs, and thus there is more shunting, and it will lead to breathlessness or hypoxia. Similarly, if a patient is having underlying lung disease, which is involving the base of the heart, base of the lungs. So suppose there is interstitial lung disease, which is or interstitial pulmonary fibrosis. If it is involving the basis of the lung, or commonly the basis of the lung, then what will happen is that what will happen is if in sitting posture, more blood will go to the basis, and there will be ventilation perfusion mismatch. So more will be the ventilation perfusion mismatch, more will be the hypoxia, and more will be the breathlessness in case of hypopnea. So this is what is the explanation for hypopnea. Hope you have liked this video. If you want more video like this, do subscribe to my YouTube channel, Dr. Akif Beg. Thank you.